Hi, everybody. I'm Dr. Amanda Foo-Ryland, and I am here with my very, very first guest on the Thinking Out Loud Longer podcast, and that's Ros Gellatly. Dr. Ros, may I say. I'm really thrilled to be interviewing Ros. I'm here in Portugal, in my beautiful home, and Ros, you're all the way down there in Blenheim, New Zealand. Good evening. I hope you've had a beautiful day out there.
It's been a stunning day here. So
Fabulous.
It's been amazingly hot. Yeah.
Well, I'm very excited to interview Ros. Ros and I have spent some time together. Ros is actually a part of our community at Your Life Live It. And as well as being a medical doctor, coming up 40 years this year, 1984, Ros qualified as a general practitioner and has had practices in Australia and in New Zealand, and currently works out of a practice in Blenheim. And what's very exciting really is that for somebody that's worked in medicine for 40 years, Ros, I'm really, really curious to find out more about your curiosity. I think somebody that spent all that time working with patients from that model, to be so curious to learn more about what happens with our neurology. Just tell me, how did your journey with neural coding begin? What was the start-off point for you?
Okay, years ago, I did some work in the early days of what was then called NLP. And then life just got busy and those things didn't happen anymore. And I also did some training at some stage in some basic hypnotherapy. I've always been interested in alternative approaches to healing, and I'm always in awe of what people can do. The final part really started about 6 or 7 years ago, when I'd had 5 years of burnout, getting close to the end of this career in general practice. And I was looking for, how am I going to work my way through this? First of all, I was quite shocked that I hadn't realized how bad things had become and what sort of treadmill I just got myself onto. You go to work, come home, you have something to eat, blob out on TV, go to bed and do it all over again. And so, yeah, I decided I would look for a life coach. I felt that I had enough understanding of my own processes, but I really wanted to start to think, okay, how do I get out of this? Where do I need to go? And I stumbled across Alan McIntyre in Southland, one of the Your Life Live It coaches. And it was through him that I came across the Ultimate Transformation course and signed up. And I worked my way through that course with fabulous Kate Finn as my mentor. And she'd had a background in nursing, so she understood quite a lot of the issues that I was seeing and how our interactions with patients could actually help or drain you, really. Anyway, that's the start of it. And by the process of going through that course, I realized that actually this was something that felt really good to me. It made a lot of sense to me in terms of that ability to help people make the change at a fundamental level. And I also reignited my interest in hypnosis, hypnotherapy. The people that I trained with some years ago brought a chap out from the UK who did this amazing process with people with chronic pain, and I was hooked. God, this is just incredible.
So I just interject there, Ros.
Yeah.
I think it's really testament to you, because I think when you're educated and you study so hard to become a doctor, we know how many hours that takes and years that takes, and then the hours that doctors work in practice, it's long hours. you know, and hence burnout. You know, I don't think it's unusual that many medical doctors will experience that. And if we've got doctors listening to this now or watching this now, they'll be like, yeah, I totally feel you, Ros. I think it's testament to you, though, to kind of go, well, hang on, the healing can happen elsewhere in the whole person. You know, there can be some internal healing through neurology, through the capabilities of our unconscious mind or our subconscious mind, which is what most people probably will know it called as. And hypnotherapy really speaks directly to that. So I think the fact that you even looked at that years ago as a young GP, you know, probably in the throes of busyness of practice, is testament to you and your curiosity to, you know, how can I really help my patients? How can I help them perhaps in a slightly different, more organic way? But clearly you saw some results with the gentleman that came and did the demo with chronic pain. So for you, that must have been amazing to see.
It was really extraordinary. And that was another point in terms of going, if I could help people like that, wouldn't that be absolutely amazing? And the two modalities, if you like, just dovetail so well together and support each other. Plus, the neural coding has so much, and in fact, the pain process are based so much in what we now know about how the brain works. And it surprises me that more people haven't then gone to the next step of going, well, knowing what we know, and it's the brain's interpretation of pain and so on, why aren't we doing this more in terms of going to the next step and going, well, if that's where it's happening, we can actually influence that.
Yeah.
And allow people to take some control back of what's happening in their lives. It's extraordinary.
And I think you're right. I think, you know, most people that will go to the pharmacy to get ibuprofen or paracetamol, or people that are in chronic pain that are, you know, on painkillers and have been for a long time, they think that pain's being done to them. It's something that's happening to them from an external source. It's actually, it eludes people that pain is being replicated in the brain. And therefore, you know, you're quite right in what you're saying in that, you know, well, why don't we work at where the source is? And let's reprogram that piece. And that's really what that hypnosis piece was that you experienced that gentleman doing, is, you know, just reprogramming. Really, it's neural coding through hypnosis to allow the brain to see this differently, so it can switch that pain alert off. You know, so for you, that must have been like finding golden chest.
It was. Don't get me wrong. I mean, acute pain and pain that signals that there's something that needs to be checked out, that's a completely different process. And I'm certainly not interested in how we can interfere in that process. But that the chronic pain situation, where often there is no medical diagnosis, or if there is, you could have the condition, but do you really need to have pain as well if you know what's going on and you've had all of that checked out? So that's been quite a revolution, but it also fits for me because there is that basis in knowledge. It's not woo-woo stuff. It really is. We now have the information that actually backs up what people have been thinking is working in the past, and now we know why.
Yeah.
And that's extraordinary. It's really exciting.
Very exciting. And so, you know, you you went to see Alan because you knew things needed to change for you. You know, as a professional, working really hard, coming home, you were just kind of saying to me that it was treadmill, come home, eat, relax, sleep, get up and do it all again. And you recognized that there was a problem. And therefore, did you find, well, I suppose, my question to you is, in your experience of mental wellness, did you feel it was going to take a long time? Was that do you fear it might take a long time to get the outcomes that you wanted, or were you pleasantly surprised by the speed at which you got the outcomes?
Interesting question. For me, that course wasn't necessarily a kind of wham, bang, all of a sudden. It was a process.
Yeah.
And when I first started, some of the things that I was being invited to do, like creating future memories, it's like, what? What is that? And, you know, exactly. It was like really weird. And I didn't think that it would have had much impact. But as time has gone on, I look back and I think, of course, that is so extraordinary. And since now becoming able to put this into practice for myself with some of my own patients, it's just amazing watching people make change that can be very, very rapid. And that's really an exciting thing about this. It doesn't have to be a long, drawn-out process, and people can make really fundamental changes, and that's amazing.
It is. You're absolutely right, and I think, you know, this is where people that come into contact with neural coding, whether it's working one-on-one with one of our people, or whether they do one of our small courses, or read a book, or listen to this. I think what's interesting is that many people don't know about it. And when people find out about it, you know, it's a bit like, why isn't this in schools? You know, why don't more medical professionals know about this? It's almost like it's a secret and a little bit too good to be true, but it's not actually. It's just neurology. And providing the patient, or a client, as I'll call them, patient as you call them, is ready to change and prepared to do whatever it takes to change, then the results are there. And so that kind of nicely leads me on to my next question, Ros, because I remember Kate Finn phoning me, who was your learning mentor, who guided you through the Ultimate Transformational Course journey. And she thoroughly enjoyed working with you, of course. And now I've got to know you, I can see why. And she called me and she said, look, you know, I think Ros really would like to join the community. I think she'd like to join Your Life Live It. And I was really intrigued to have a call with this lady that spent nearly 40 years in a medicine model, that wanted to kind of switch tactic, if you like. So I'm intrigued to know what it was that made you think, I'm going to join Your Life Live It, and I want to help my patients with these tools. What was the reason for that?
I think I've always known that part of the healing process is the interaction between myself and patient, client. Despite all of the other trappings around it, you know, medication, surgery, blah, blah, blah. But this just took it to another level, and I have the ability to do something that's still really helping people, gives me huge flexibility, and also that ability for people to make change without any of those things, and starting to get an inkling of their own power. And I love that. I just love watching what happens.
So good.
Yeah, it's amazing. And the range of things that can be helped with this, and the range of different issues people come with, it's extraordinary. I mean, they're the things people think of, like, you know, stopping smoking and maybe bedwetting in kids and simple things like that. But anxiety and phobias and trauma and all those sorts of things, where it's just so exciting to get something that can happen really quickly and be a profound and lasting change. And that changes then everybody's experience of their lives.
Yeah. And the ripple effect of that, you know, if you've worked with somebody that's had even a phobia for years, and then that all of a sudden they heal that in themselves. I mean, one thing we always say is that we don't do the healing, the individual does the healing. We just hold the remote control, right?
Yep,
the knock-on effect, the ripple effect to their immediate family, to their close friends, you know, to witness this person in freedom, you can't even calculate what that would be from a positive perspective. So I think I think it's real testament to you, Ros, to go, you know what, I really want to help and I think that the thing I've just learned from you is it wasn't about, oh, I found a new way to allow people to create change quickly that's long-lasting change. It was more, I've found a way to allow my patients to step into their power.
Yeah,
To find
absolutely.
their power, to find their genius, to reconnect with their true source of power, and to take responsibility for where they're at. And when I say responsibility, that sometimes has a negative connotation, but I don't mean it like that. I mean, it's like they're truly
No.
stepping in. I'm being responsible. This is my life and I'm living it. So I think that's the epiphany that I've just picked up from that share that it is facilitating that and allowing somebody to realize how powerful I really am.
Yeah, yeah, absolutely.
In New Zealand, on our practice in New Zealand on the wall, I think you've seen it, Ros. It's a huge sort of piece of art, and on the outside of it, it says you are so much more than you think you are, and it's just there on the wall. And clients come in and sometimes they notice it consciously, sometimes they don't, but unconsciously they will obviously absorb it. And I think it's pointing to that, isn't it? That we get just bogged down in day-to-day conscious living, and we forget how powerful and powerful in a very empowering way each individual is. So yeah. And how have you found, so how long is it now that you've been using this toolbox with your patients, Ros?
It's probably about 18 months or so.
That's a
And
fair amount of time.
yeah, I just had a look at my last year's clients, and it's not a big number, and I would like a lot more, but I was fascinated at the percentage of people, like 70 to 80% of people actually achieve goals that they wanted. And I don't know of anything else in medicine that actually is as good as that. It's like, wow, amazing.
Yeah.
So that was really a little bit of a proof for me to go, all right, this really does work. And it's not, these are amazing tools.
Yeah.
But I think that whole thing about people knowing themselves and having the wisdom within themselves is also something that I've held really importantly over all the years. So this is just a different way to honor that in others.
Yeah, sure. And I think for anyone listening or watching, I think it's important that we point out that neural coding is not counseling and it's not therapy, different labels put to different modalities. And it's not that counseling doesn't have a place. Counseling absolutely has a place. Various forms of therapy have a place. I think neural coding, if people are kind of like, well, what is it? Probably the easiest way to describe it, Ros, and I wonder if you would, well, maybe I should ask you to describe neural coding rather than me describe it. I mean, how, from your patients, I think you've kind of alluded to it in that it's quick and it's effective, it's fast. Is there anything else that you'd like to use to describe neural coding?
Well, it's an opportunity for people to discover how their brain works. And most of the time, we don't even think about that. How do you know that something happened last year? Or how do you know, what you're thinking about or worrying about? And so when people start to realize by doing this work, this is how my brain works, and everybody's different, and that's fine, absolutely wonderful. It's like, it brings that whole thing into their awareness that all of this process is going on, and then going, right, well, let's use what and actually make the changes at that fundamental level.
Yeah.
And I just find it amazing.
Yeah, I think you've absolutely explained it. It's really when people are Well, let me say, if anyone's listening or watching and they want to be fixed by Ros, you know, what Ros to wave a magic wand, neural coding is probably not for you. And it's not that it's never going to be for you, it's just probably not the right time. Neural coding works really well when the patient or client is like, I've just had enough now. Like, I've had enough, I've tried. And to be perfectly organic, as perfectly transparent, we generally are the last port of call. You know, in my years of working with neural coding, most clients we work with are medicated. They've tried lots of different things, and it's generally come through a referral, and sometimes from a medical doctor, to us, because it's like, I've just had enough and I just want to give this a go. And it's I think it works particularly well when somebody's just ready to just be curious and learn about how they can help themselves in a really simple framework. That, as you say, Ros, it's quick. It is fast. I mean, we're talking about booking 3 to 4 sessions with a client over one enormous presenting problem, whatever that might be. This is not weeks and weeks and months of booking in to see the same person over and over again. So I think that's where it's slightly different. And for you, you know, 70–80% of the patients that you've seen have walked away with the outcomes they wanted. That's incredible. Particularly when you've worked for 40 years helping people and obviously seen lots of things come and go. And there's the prescription pad, of course, and medicine does have its place. I wouldn't be sat here if it wasn't for modern medicine, I have to tell you, having had kidney cancer, so I'm eternally grateful for that. However, the understanding and the curiosity around what's in here is immensely powerful. Is also, I think, what neural coding is all about. So Ros, I want to thank you for trusting us all those years ago, going to see Alan McIntyre, who was one of our first neural coders to join the Your Life Live It family. He's been with us many years and does great work down in Invercargill, along with Kate McKay, who's also a part of our family down there. And in fact, even Alan's wife, Linda McIntyre, who is a nurse, has become curious and qualified with us. And one day will be client facing with us. So, I'm eternally grateful for you trusting yourself to find somebody that could help you get the outcomes that you wanted. And then being curious, being a learner, going on the journey with Kate Finn, and now being able to help your own patients achieve those amazing results over the last 18 months and for many more years to go. I have one last question for you, Ros, before we sign off. And my question to you is, if you could give your younger self one piece of advice, what would that be?
Oh dear. I think it's something about trusting that somehow you'll get through whatever it is. And yeah, that there's more still to come. This isn't the place where you're stuck. You've got a whole place to move.
Yeah.
Keep going.
Yeah, good. So that it's, just trusting, knowing that this is just a phase, just keep going. And there's so much more. There's so much more. Beautiful.
Yeah.
Beautiful, Ros. Well, I want to thank you so much for your time, taking time out of your busy schedule to join us. And anyone watching or listening to this, if you are curious to find out more, we will put Ros's contact details in the link below, and please reach out to her. I know, having spent time with her in Queenstown, New Zealand last year, where she qualified in her master's in clinical hypnotherapy, which was just the most awesome time that we had together, that she's full of compassion, full of empathy, and just a a damn good person to be around. You can't help but feel better just being in her space. So anyone that wants to know more, just reach out. You might just have some questions. You might just want to have a chat with Ros, or you might decide that you want to book some time with her, and then Ros will navigate you through how all that works. So we'll put Ros's links below to our website. You can take a look at what neural coding is. It's a website that's full of resources in there and videos, and check out the frequently asked questions. If you're very skeptical, and we love people that are skeptical, don't we, Ros? We absolutely love that skeptical brain, because what that means is that you've got skin in the game and you're making sure this is right for you. So if you're one of those skeptical sorts, don't think, well, that's not for me. Get skeptical and come and use your skepticism. So engage with us. And Ros, thank you very, very much. And as we like to say at Your Life, Live It, remember, it's your life, live it.